welcome back. Joining us for our second conversation is Dr. Rachel Corridon from Harmony Health in Trinidad and Tobago to talk to us all about empathy in healthcare for Caribbean women. I was talking to her a little earlier to say how impressive she is. She has over a decade of being an experienced physician, specifically in obstetrics and gynecology. She's a UWI alum. I'm also a UWI alum, so I'm going to be excited to talk to her about that. She's also a graduate of the St. George's School of Medicine, a member of the Royal College of Obstetrics and Gynecology in the UK, and she's here to talk to us to have a very exciting conversation about healthcare for Caribbean women. Dr. Corridon, thank you for joining us all the way from the land of oil and music, of doubles, of bacon shock. Welcome, Dr. Corridon.
And don't forget roti.
And
roti, yeah, there you
How
go.
can I ever forget? And what's up shot is my favorite. I make it all the time. I feel so indulgent, but it's a delicious, wonderful, wonderful, wonderful dish. Thank you for joining us.
Yes. Thank you for having me.
All right, so let's dive into our conversation. Like I mentioned, you are an experienced physician and your specialty is obstetrics and gynecology. How did your professional journey shape your approach to healthcare for women in the Caribbean?
Well, my professional journey actually started before I became a professional, from childhood.
Oh, wow.
And the impact of being around my mother, as she was a nurse, a district health visitor, a theater nurse. So for my entire childhood, I was exposed to that environment, and I would have seen the way she would deal and interact with patients. She's also a midwife.
Oh, wow.
So I accompanied her on some of her home deliveries. So I had both sides of the coin, the patient care side in terms of the one-on-one that a nurse would give to her patient, and I also had the experience and the knowledge as I became a doctor, and I have learned to now marry the two. So the nurse is considered the patient's advocate. Yeah. And I have also become that even as a doctor. I adopt that similar approach in the way that I deal with my patients. It's always patient first.
Definitely, and I love that you mentioned advocacy, because it's so important in the healthcare space, not just on the part of the patient, but also on the part of the provider. So when you are interacting with patients, how does empathy interplay with those interactions, especially in such a very confidential, very unique space?
One of the things I put at the forefront is that most times the patient is not aware of the information that I have. So I try to start with education. Yes. Even in helping them make a health care decision, I empower them to make that decision by educating. And that's one of the things in my practice. I actually have longer consultation times than most. And that's because I sit with my patients and I make sure that they understand. So educating, understanding is the base for my approach in terms of empathy. I also allow the patient to have a voice, listening, so that I can understand their point of view and where they are coming from. And also, being a woman myself, I have an understanding of some of their fears, some of their challenges, because I am a woman.
Right.
And so that all ties into my approach and the way that I am able to deal with my patients with empathy.
Dr. Corridon, talk to us a bit about home birth services. Is this something that is popular in this region in the Caribbean?
It's not that popular anymore, as most persons would choose a hospital birth. There are thoughts on safety, but it all comes down to the correct choice. So you want to ensure that a patient who desires a home birth is a good candidate for it. And of course, patient choice as well. So once it is safe, if a patient approaches me as a provider, I would go through it with them. Of course, I would let them know about the risks, about the benefits, the possibility of needing to actually go to the hospital during the process of having the birth. challenges that may occur. But it's a patient's choice, and it's an option that is available, but it's not a very popular one at this time.
Why would an expecting mother opt with a home birth as opposed to everything that is available if she checks into the hospital?
Most times it's because of the peaceful nature of a home birth, and also the ability for them to command their own space.
Yeah.
Also their ability to have choices in terms of who is in the room, having a holistic birth plan that we go through together before the home birth actually occurs. So we see the patient on multiple occasions before the home birth, and we kind of get an idea of what the patient is like, what their desires. We meet the family, we meet their children, because most times, let's say in the public facility, you may be allowed one birthing partner, but when you're at home, you can have any amount of persons that you wish. And also in home birthing, we tend to have a more hands-off approach, meaning we use less interventions. It's more likely to have interventions when you are at the hospital, but of course everything must be done safely. That is the basis of even considering a home birth. Safety always comes first.
Yeah. Well, Dr. Rachel, I know that you have a wealth of experience both in the region and internationally. I know that you've done a bit of your residency in the States, in New Jersey and New York. And I mentioned that because when I think about the challenges that women face in the Caribbean when it comes to healthcare, it looks a little different from maybe someone in North America or in the UK. Can you talk a little bit about what some of those challenges are, especially when it comes to making a choice to either go to a hospital or versus a home birth, having a home birth?
I would like to say that our facilities are actually very good. And so there isn't, yes, there are some things that may not be available that we may have in first world countries, but basic maternity care is actually of a very high standard in the region, and especially where I practice. In terms of a patient having a home birth, we usually don't require much. Yes, and so we require the basic tools to ensure that the patient has a safe home birth. And so the challenges are there, yes, but I believe we are able to achieve the home births and safe maternal care with what we have.
Well, I'm really happy that you mentioned that, because I think there's, especially in recent years with younger women giving birth, a lot of the deliveries are done through C-section, and you wonder why that's the case. You find the experience has been maybe the doctor schedule that date, so they have no choice, or maybe there's a complication with the pregnancy. What are some of the reasons why we see this rise in specifically hospital deliveries versus home births? And I ask because, like, I think about my parents' generations and my grandparents' generations. A lot of them were born at home, and they came out fine for the most part. They came out fine for the most part. So why is there a shift kind of to going more towards having a hospital to birth, maybe C-sections versus home birth?
The shift is basically because women generally feel safer at the hospital. There's a lot more staff there. You know that if something happens, we are able to act much faster than if it's a home birth. For instance, let's say that a delivery is delayed. At home, you have to wait for ambulance transfer, for instance. Whereas that transfer, let's say to an operating room, if you're in the hospital, could take as little as 5 minutes. So it's mainly a safety issue, a fear factor, a knowledge issue, and patients generally are becoming less likely to take the risk. And also you have what they would have heard, the taboos and the stories of poor outcomes that would have happened in the communities with home births. So it's not something that I push on a patient, but certainly if they request it, if they inquire about it, and if the patient is a good candidate, we can have the conversation.
I wanted to also jump back into the part of the conversation where we talked about advocacy and patient advocacy. I think as women, we should also feel empowered to be our own advocates when we're in the medical office, when we're consulting with our doctors. What are some of the kind of questions that you would encourage or empower pregnant women, female Caribbean patients to ask when they're having that conversation with the doctors about the benefits, the risks, when it comes to making a decision about their bodies?
Well, firstly, I would encourage women to know one basic thing: their last menstrual period and when is their due date. So many of my patients would come into the room and I ask them this question and they don't know. So having that information is the first thing.
Nice.
What is your first day of your last menstrual period and when are you due? And then I want you to be able to tell me your history, right? Your history your medical history is a very important tool in being able to determine your risk factors and how we are able to manage your pregnancy. And so once you are able to express your medical history, you are then able to ask questions related to yourself. So know yourself. And then when a doctor gives you an advice or a management plan, feel free to ask why.
Yeah.
In my training, one of my consultants would always ask us during rounds, what will you do and why? And in us being able to answer that question, we are able to counsel the patient. And it is the patient's right to ask me, what am I doing with their care and why? The patient should also be able to have some sort of say in terms of interventions that may be required. As I tell my patients, the information that I am giving you is for your best interest. However, at no point in time is it something that you must do. But I am giving you all of the information to make a well-informed choice for your care and for your baby. And most times, at the end of fully explaining everything to patients, they usually make the best choice. Yeah? So know your history, ask why. And when we are writing essays in my time it was common entrance. Don't think.
Wow.
When we
That's a while back,
when we
Dr.
were doing our
Corridon.
essays, we would say who, what, why, when. So who is going to take care of me? When is this going to happen? Why is this going to happen? And what are the reasons? Yeah?
Yeah. Well, Dr. Corridon, before we let you go and maybe go enjoy some doubles or roti for the day if you choose, what would be some of your health tips for women who are currently pregnant or women who are looking to become pregnant on how to optimize their uterine health and their overall health reproductively?
Sure. The first thing is your preconception visit. At your preconception visit, again, we go into your history, we go into your medical conditions. We want to make sure that all of your medical conditions are optimized so that you are at your best healthy self in order to become pregnant. You can bring your partner along for that visit as well, and we can have some really, really nice conversations. All women who are trying to get pregnant should be on folic acid to ensure the infant's brain and spinal cord grows well, because this happens in the very early stages of the pregnancy when you sometimes are not even aware that you are pregnant. I would encourage patients to book early when they do become pregnant. We want to do an early ultrasound, ensure that the pregnancy is actually in the womb, for instance, and it's not, let's say, an ectopic pregnancy that could be a danger to your life. And as the pregnancy goes along, I want you to keep up your visits keep the doctor's advice in your mind at all times, and also understand that as the pregnancy progresses, there are certain issues and challenges that may occur. But remember, even though you may become overwhelmed, we as your physicians, your providers, the nurses, the clerks even, everyone is here to take care of you.
Yes.
And to ensure that your process of pregnancy is a happy one and that you have a good outcome. At the end of the day, we want to send mommies home with babies.
Yes, definitely. Well, thank you so much for joining us, Dr. Corridon. You have been a vision in pink and an amazing conversation. We really appreciate you taking the time, joining us all the way from Trinidad and Tobago. Have a great day, and thank you again.
Thank you so much for having me. Bye, guys.
Take care. All right, well, we are going to take a quick break, and when we come back, we're talking to the folks at Bowen about their pre-mixed drinks. Stay tuned.